you for joining us today. If you wouldn't mind, if you could introduce yourself in the chat, just your name and your organization, that really helps us with attendance. And if you have any questions, feel free to unmute and ask or put them in the chat, or we will have a lot of time. This won't take the full hour to go through the PowerPoint, so we'll have a lot of time after this for questions. And then we have several staff members on, so there is the possibility when we're done here, if you have a question that you just want to ask like privately, we can put you in a breakout room with a staff member and we can go over those questions too. So, all right. So thank you everybody for introducing yourselves in the chat. I do want to kind of start us off by going over the mission of the Iowa Cancer Consortium. So our mission is to advance cancer prevention and control in Iowa through advocacy, equity, and collaboration. And definitely all those three things have a role in the implementation grants, but especially collaboration. We really want to see organizations working together on these. So like I said, we have a lot of staff members on the call. Kelly Wells-Sittig, our executive director, Rachel Schramm, our program manager. I am Liz Orton, the outreach and communication specialist. Brianna McNulty is our outreach coordinator and public health associate from the CDC. And if I missed any other staff members that snuck on, I apologize, but all of our email addresses are there and feel free to reach out to any of us. All right, so hopefully a lot of you know this, but it's okay if you don't. So what is the Iowa Cancer Plan? It is a blueprint for action, and it is located on our website. And maybe Rachel or Kelly, you could put the link in the chat for me, please. But the Iowa Cancer Plan brings Iowans together to reduce the burden of cancer in Iowa. It's created by experts and Iowans across the state, many of whom are on this call. And the Iowa Cancer Plan includes 5 chapters focused on cancer as it relates to health equity, prevention and risk reduction, early detection and screening, diagnosis and cancer-directed therapy, and survivorship and end-of-life care. And kind of the basis of the Iowa Cancer Plan implementation grants is that you would be using the plan and choosing some action items in it that apply to your program and what you're applying for. Okay, so our funding priorities for fiscal year 2025. So some of these are new or have changed a little bit. And these are all available on our website as well. So if it's a lot, if you're like taking notes or something, so it's all on our website. But so these priorities will be looked at closely by our board of directors as they're reviewing applications. So the first one is projects that address issues of health equity across the cancer continuum, especially pertaining to systemic racism, rurality, socioeconomic status, gender identity, sexual orientation, disability, and other social determinants of health. Also looking at projects that enhance mental health support for cancer survivors and caregivers. And I do want to note that we also have a different grant opportunity that's open right now, our survivorship supplement that is also for enhancing mental health support for cancer survivors and caregivers. So if that is your focus, you are allowed to apply for both, but just know that there is a grant specifically for that. So I want to make sure that you see that. And if you go to the link that Kelly put in the chat, you'll see both opportunities. All right, and then the third priority is addressing cancer types or sites that are especially high and or rising in Iowa when ranked across all 50 US states. So we have them all listed here. This is from the Iowa Cancer Registry. And that doesn't mean that if your project or your organization deals with a different type of cancer that you wouldn't be considered. Just know that these cancers that we know are especially high in Iowa will be given priority. But again, it doesn't mean that we won't look at other things. The board of directors is also putting a priority on projects that are expanding successful local projects statewide. And then projects that formalize lasting and broad change in cancer control through policy and systems change. So some grant details. For eligibility, once awarded, grantees must become consortium members if you're not already. We would just need, the main person who is responsible for that grant to be a member. And we do provide free scholarship options. So we don't want that to be a barrier. All grant funded activities must be tobacco free and held at tobacco free locations. For award amounts, we award up to $25,000 per year. And I do want to point out, in case it's not noted somewhere else in this PowerPoint, the grant it runs for 11 months. So when you're doing your budget on the application and things like that, just remember that you're calculating for 11 months and not 12 months. And then you are eligible for up to 3 years of funding with a competitive reapplication each year. So nobody is approved for 3 years all at once. It would be on a year-by-year basis. What's allowed for the use of grant funds? Staff salaries, consultant fees, data collection and analysis, meetings, supplies, project-related travel, and other direct project expenses. We also fund indirect or administrative costs up to 8% of the funds that you're requesting. And I believe it says in the application, there's some more details, but there's a note that if you have a strong need to request for more than that, you would just need to provide like some strong justification for that. Things that are not allowed are lobbying, not allowed to replace dollars currently earmarked for cancer programs, not allowed for clinical care, including the provision of medication, vaccinations, or cancer treatment. Things that will be considered are service delivery, including radon mitigation and cancer screening. Those things, those in particular and things like that will be reviewed on an individual basis. And then a note about incentives, because we do see these in budgets a lot, like offering an incentive if somebody comes and participates in your program. That's allowable as long as it is part of an evidence-based intervention that providing incentives is evidence-based for what you're doing. Okay, so project activities must serve Iowans. The evaluation process. So when we get our applications or your applications, we send them out to a group of independent reviewers who are experts in the cancer control field, and they are outside of the state of Iowa. They score them, but the people who really decide who is awarded is our board of directors. So they heavily rely on these external reviewers to kind of help them rank and, consider different things, but they have the ultimate decision. And they are also very careful and open about disclosing any conflicts of interest and things like that. So we're very careful about that too. And then, they're scored by the board of directors, and then they're discussed and voted on by the board of directors. The monitoring process. So our staff here at the Iowa Cancer Consortium will work closely with grantees to ensure they have the tools to be successful and to maintain stewardship of state and federal grant funds. Grantees are required to submit quarterly progress reports, including a short narrative and financial update. And additional details and reporting dates will be shared with funded applicants upon award acceptance. All right, so here's the little handy dandy application checklist. And again, this is all on the website. This is very important. We do this with a letter of intent. So we will need to have a letter of intent from you emailed to my email address by 11:59 p.m. on April 26th of this year. And we have samples on the website. This can be brief. It doesn't have to go into details of exactly what you're going to apply for, just that you know, you are so-and-so from this organization and you intend to apply in our invitation for proposals. And you can, I think it also gives an example of kind of at least mentioning like what area of the cancer plan you are intending to work on. But we definitely have times when that changes for someone. So just keep in communication with us, whether the focus of what you're going to apply for changes, or you decide it's not in your capacity. We had a weird fluke of events last year, I feel like, where there was a lot of staffing changes where unfortunately people weren't able to apply. So just keep in communication with us. Let's see. And then so on the checklist, make sure that your project addresses goals, priorities, strategies, and/or action steps within the Iowa Cancer Plan. Make sure that your budget items are explained and that your totals are accurate. And again, that you're working on an 11-month time period and not 12-month. Make sure that your letters of support are included from all of your collaborators that you list on the application. And we have example documents for letters of support and for the budget on the website. And then include any resumes or CVs for staff members if funding is requested for their time. And then if possible, we know just based on what kind of software everybody has, it's not always possible, but if possible, compile all of those application documents into one PDF. So, you know, your application, the budget, letters of support, resumes, put them all into one PDF. But if you're not able, send them all to me and I'll put them together before they go out to the external reviewers. So then you'll email that completed application to me by 11:59 p.m. on May 24th, 2024. And then this just shows you what out of these do we have examples of on our website. So take a look at that. Okay, so resources on our website, you can read about the funded projects from this current fiscal year to kind of get an idea of what we have funded. You can also take a look back at, we have a couple of annual reports on our blog from the past 2 years. So those highlight implementation grantees. You could take a look at those. There is a link on the grants page to learn about evidence-based interventions in public health and some resources for finding those. You can access Cancer in Iowa reports with Iowa-specific data and topics. Would one of my coworkers put in the link for the Cancer in Iowa website that has all the reports? So in 2024, they really dived into alcohol-related cancers and alcohol rates in Iowa. 2023 focused on, 50 years of the Iowa Cancer Registry, but also that was the first one that said that Iowa was second in the nation for cancer incidence rates. 2022 had a return to screening after COVID. And then 2021 has some really good information about racial health disparities in Iowa. So if that's a focus of your project, then definitely check that one out too. Another resource is a link to practice SMARTY objectives. So maybe you've heard of SMARTY goals or SMART goals. And now I'm like putting myself on the spot to name them all, but the ones you maybe haven't heard of are the I and the E, and that's for inclusion and equity. So not only making sure that they're like time bound and measurable, but also that they're inclusive and that they're equitable. So again, these dates, letters of intent are due April 26th. Applications due May 24th. Tentatively, if everything goes according to plan, then we'll be notifying grantees on or around June 28th. And then the project period would start on July 1st and run through May 31st. And that's just because of our own fiscal year and how that works. So we are all here to help. This is the majority of our staff. There's even more that aren't pictured here, but We encourage you to reach out to us, discuss your ideas and projects. We as staff do not choose who gets funded, but we do support applicants and the grantees after they're funded. And whether you reach out to us or not won't affect your score in any way, either way. And if you do want us to like review your application, just make sure that you give us enough time before the due date, so that we have some time to review that. So you can either email me directly and I'll kind of, if I don't know the answer, I just kind of ask around. You can also email the staff at canceroiowa.org email address. And our coworker Kelly Rollins helps and gets that to the right person. And I think that's the end of my slideshow. So I'm gonna stop sharing. And what kinds of questions do folks have? I'll just kind of open it up, or to Kelly, Rachel, anything that I left out that you want to make sure that we talk about? All right, so any questions? Jason.
Hey Liz, thanks again for the presentation. I just had a quick question. If you or anyone else from the consortium, looking back at some of the past applications over the last few years, what would you say were some of the lessons learned from either the applicants or maybe what you all saw that could help future applicants? Thanks.
I can take a stab at that. One that comes to mind has kind of come up within the past couple years, and that is that the board really doesn't want to see a, for example, quality improvement project for one organization or one clinic or one health system. Collaboration is just really key for the interest from the board. So they're looking more for, I think if a health system or a clinic or an organization is partnering with community, that is really important, or with other organizations. Those are the types of things they're going to look for rather than, again, a quality improvement project that improves service at one location. So they're really looking more for those broad public health, and collaborative impacts. Also, generally not funding research. So again, I think that one has a little wiggle room, right? Like, because if we're talking about working with community, there are things we're going to want to measure, and so that definition of research might be a little bit wiggly. But in terms of like things like basic science, those kinds of things, not funding specific research projects, still with interest in measuring implementation and partnerships with community and other organizations. Those are a couple big ones, and I'll kind of keep thinking a little bit about, if any others come up.
Yeah, and Lori put a good point in the chat, where not looking for most of the funding to go towards like equipment purchases. Equipment can definitely be a part of it, but not like the whole amount has not been successful in the past.
Yeah, thanks, Lori. I will say too, the board does a really nice job of not funding based on grantsmanship. So I think that's good news for most people. They really want to hear, they want to have a clear picture of the ability of a project to be successful. So things like the objectives and SMARTY goals, those are important, but they're really looking for the description of potential impact and how they can know that the project can be successful. So those are the things to think through. Don't worry too much about like wordsmithing and that kind of thing. Make sure all the components are there, but they want to know who's doing great work and what great ideas you have. So just to add a little, little ease to that, they do a nice job of really considering the value of the applicant and the application outside of that.
Any other questions? Sydney.
I guess going off that question, and you said collaboration, is there a certain amount of collaborators? Like, is it, if you only have 2, is that fine? Or, I mean, if you have like 10, just kind of depending, does that have any effect on the board and when they're looking at your grant proposal?
Yeah, I think that I have to pull it up. I think that the application asks for at least 2. And then anyone that you do list, you do need a letter of support from. And 10, if they were legitimate, like really gonna be part of this project, then that's great. But definitely no expectation that there would be that many. So I think on average, probably like 2 to 4 is what we would typically see. But if it's, you know, we have in the past seen where maybe it's like 2 different people from the same organization were both listed, and, you know, like that's not as strong as having like really different organizations or things like that you're partnering with.
Gotcha. So not obviously having 2 people, like you said, from the same organization wouldn't be as strong as having, you know, 3 different organizations. And then I guess my other question was, as someone who's, you know, new to the role and hasn't written any grants at all, like what do you have advice for someone for like writing grants?
Let's see, Rachel, I will let you answer this, but then I would just quick say, like, don't be shy of sending us what you have, so that our team can take a look at it. But Rachel explains grant writing so beautifully, so take it away, Rachel.
Oh, Liz, I think you just like that I mentioned the butter cow every time. I always think of grants like sculpting the butter cow at the state fair, because you are not, even if you have the most well thought out plan, you can't just write a grant in one shot. I think it's so much better to kind of have like maybe an outline of kind of what you think the project is and just the different elements as far as like the time, the money, you know, kind of what your big goals are, and then bring that back into the grant application. We try to be really straightforward on what we want, but like Liz said, we're happy to review if anything's confusing as well. But, you know, just to dedicate that time, put in, you know, what you want to do, but then don't be afraid to kind of go back in different sections and sort of refine. That's what we like to do.
Awesome. Thank you so much.
Mhm.
What else, everybody?
Liz, I have a question.
Yeah.
You talked about, oh, no, I lost it. I lost my lead in. I still have my question. If awarded a grant and it's an 11-month period, how much post-award reporting is involved, and what does that look like if you receive a grant?
Kelly, could you take that one?
Yeah, great question. And we've changed it a little bit within the past year to try and make it easier. So previously we had 4 reports. Now we have only 3, and the middle one is just a budget update, because we need to, you know how funding works. We have to spend money if any of it comes back to us. So we just really want to monitor that. So there's a report due about the first quarter of the project, a budget update due towards like the middle to, I guess it's now really more like the first third of the project is the first report. Second third is really that budget update, and then a final report. So we're trying to make it lighter and are open to feedback from that. But yeah, so 3 but only 2 are narrative, and that includes the final report.
Okay, great. And are the funds awarded upfront or on like a drawdown basis?
Yeah, great question. 50% upfront, 45% with the second report, and then the final 5% at the end of the project.
Perfect. Thank you.
And I will say, like, there's a lot that we can be flexible with. So we never want that pattern to keep somebody from being able to do a project. So and the same goes for like the timing of things. Like we can be pretty flexible, but we have to know well ahead of time, or as much ahead of time as possible. So if there are any barriers that like are being faced with timing of reports or timing of money, I would encourage you to reach out, because often we can work around that.
And then everything that we've talked about today, the deadlines and such, that applies to both grants, right? The survivorship and the regular one, or is there a different?
They're slightly different.
Okay,
Yep. So take a look at both. And for others who are interested in that, like emotional and psychosocial support for cancer survivors and caregivers, definitely take a look at that specific page. Because yeah, they are a little bit different.
okay. Thank you.
Mhm.
A quick note on that too, the fact that that grant mechanism exists, the survivorship one, does not mean that that same type of project isn't appropriate for the cancer plan implementation grant project too. So you can, like, don't be, the survivorship one, we will only be able to make, well, we don't know. It depends on the applications that we get, I guess. But we may be able to make quite a few, like fewer awards for that one. But the same type of project is absolutely appropriate for the overall cancer plan implementation grants too.
Thank
And
you for that clarification.
the way that we set up the timing on that one, so I'll put the link in the chat so that folks know what we're talking about. But so for one thing, the survivorship supplement does not require a letter of intent. The application itself is due on April 29th. And awards tentatively announced May 17th, which is before the application is due for the Iowa Cancer Plan Implementation Grant. So ideally, we did that so that if you're awarded that survivorship supplement, you would already know that before you have to put in the application for the cancer plan grant. Any other questions? And like I said, we'll hang around here. If you think of anything, or if you just want to ask more privately or anything like that, feel free. But anything else before I let the majority of everybody go?
Just a quick question about your total budget. So if everyone were to apply for the full 25, how much do you have, more or less this year? What are you thinking?
Well, Julie, it's a great question that we don't know the answer to yet. I'm hoping we'll have more than this year. So this year we only had about 75,000 in just the implementation grants. We had some survivorship funding too, so similar to the opportunity that we'll have open next year. So a total of about 100,000 between the two. I'm hopeful we'll have a little bit more, and it really does depend. Like, there was quite a while where we were getting about $15,000. People were proposing about $15,000, and then last year most of them were $25,000 proposals. So it really depends, and we should have at least 75,000. I hope we'll have a little bit more than that for next year, but we just don't know yet. And I know that makes it hard, sorry. But if it helps to put it into perspective too, like we usually get, I would say anywhere from like 17 to 25 applicants. So your odds are still pretty good, like compared to a lot of other grant mechanisms, you know, who are getting hundreds of applicants. We may not have as much to award, but we, you know, the odds are still pretty good.
Yeah, and we've also seen the board get creative if there's, you know, something that they're really excited about. They might, we might approach that I guess like applicant with some ideas of, you know, like, okay, if we gave you this lesser amount of funding, like what would you still be able to do? And kind of be flexible in that way too. Yeah. All right, well, feel free to drop off if you don't have any questions. Feel free to stay on if you do. But thank you, everybody. We're excited for your interest and excited to see what you're gonna turn in and what you're working on. So thank you.